was 29 years old and I had no pre-existing conditions. I'd never needed medication for my body.
A positive COVID test led to a debilitating slew of symptoms. We check in on life after long COVID, where Mikayla Dreyer stands 4 years later. Good morning. I'm Alexis Del Cid in for Jessica Lovell. Welcome to the Morning Medical Update. Mikayla Dreyer was 29 years old when she got COVID in December of 2020. Before that, she was so active. She was a long-distance runner who hadn't taken a sick day in years. Michaela tested positive for COVID, which led to trouble breathing, walking, sitting, even talking. Weeks of sickness turned into months, and her symptoms multiplied.
I knew I had COVID, but I didn't know why I was having all of these symptoms. 29 years old, I'd never had to be afraid that I might not wake up in the morning because I wasn't going to breathe.
So scary. She went from being a perfectly healthy to needing a wheelchair. Her infection had triggered a bigger problem in her nervous system. Doctors here at the University of Kansas Health System post-COVID clinic diagnosed Michaela with a condition called POTS. We have been following Michaela's journey closely since that diagnosis, and her symptoms have improved. But that's not the same as being back to normal. We are really happy to be catching up with Michaela again this morning, though. Michaela, you look really nice, and you've had some big changes in your life. How are you feeling today? Oh, we don't have your audio.
I'm doing a lot better.
Can you repeat what you said? The audio is off a little bit.
Sorry. Hi, I am feeling great today. It's been a long journey, but I've made a lot of progress, and I'm feeling good.
That's what I like to hear, because when we first met you, you were pretty desperate. And we want to welcome back Dr. Brandon Comfort, who joins us as well. Dr. Comfort is an internal medicine specialist who also worked in the post-COVID clinic back when there were just so many patients like Michaela dealing with the after effects of COVID. And we're also going to bring Dr. Dana Hawkinson in with us as well, the Medical Director of Infection Prevention and Control. Now, Dr. Hawkinson, we know you're more focused on the acute COVID infections, but you could help us understand how infections can lead to bigger problems. So we're going to just dive into the discussion this morning. And Michaela, something really beautiful that happened the last time you had joined us, you had just had a baby. And your baby is adorable. There you go. What's his name?
August. He is 17 months old now.
And
pregnancy was awesome. Yeah, he is fantastic.
We're gonna
Pregnancy was really awesome for my COVID infection. It reduced a lot of my symptoms, and I'm sure Dr. Comfort can help explain a little bit about why that might be. But things have been going really well since he was born.
That is one of the most remarkable parts of your journey, is that during pregnancy, the pregnancy seemed to reverse your symptoms. We're going to dive into that as well. So we want to get all the answers and clarity onto how that can possibly happen. We know POTS can cause dizziness, a racing heart, fainting, especially when you're moving around and you're changing positions. But the last time we spoke, you mentioned the symptoms had gotten better during your pregnancy. Real quick, before we get into why that was, have they come back since you had your son?
There have been just one or two really brief instances where I had a couple of days of like a flare. But for the most part, as long as I've stayed on my medications, most of my symptoms have continued to stay at bay.
Dr. Comfort, do you see that in people who get pregnant, that it reverses their symptoms?
Yeah, you can see that. And so, when patients who have POTS become pregnant, the plasma volume actually increases, and that actually offsets some of those effects that patients suffering from POTS are. So we can see that actually reverse in pregnancy.
The plasma volume?
The plasma volume, blood
increases?
volume will increase, in pregnancy.
What is it that POTS is doing to a body?
Yeah, good question. So POTS, it stands for postural orthostatic tachycardia syndrome. So it's kind of a mouthful. That's why we just call it POTS in our day-to-day. And so I think it's helpful to think about what happens normally, and I think I'll explain POTS. So when we stand up or go from a seated to a standing position, gravity is going to try to pull our blood volume down to our feet. And so there's a number of mechanisms in our body that help keep blood in our head, and these are all driven by the autonomic nervous system. So that part of our nervous system that we can't control. It happens automatically. And so it's going to constrict our blood vessels. It's going to increase our heart rate a little bit. Usually maybe 5, 10 beats per minute or so is normal. But with patients in POTS, that mechanism is all thrown off. And so their heart rate may go up 30 beats per minute or more. And oftentimes we see it much higher than that. So 50, 60 beats higher. So patients go from a seated where their heart rate's 70, they stand up, their heart rate's 150. And as you can imagine, that leads to all sorts of symptoms: dizziness, lightheadedness, fatigue, headache. The list goes on and on. But really, it comes down to that autonomic nervous system not functioning the way that it typically does.
Michaela, you had mentioned when I first met you, you couldn't even take hot showers.
So, like Dr. Comfort was saying, the change in the heart rate, it was so drastic when I was first kind of going through this process. And he mentioned like 50, 60 beats per minute faster with just standing up. And for mine, I think one of the max that I got to was 210 beats per minute from going sitting to going standing. And I remember standing over my stove while I was cooking dinner, and all of a sudden my heart started beating super fast. And then with the shower piece, so hot water, or not just hot water, but anything hot can dilate the blood vessels. And so when you're standing in a hot shower and your blood vessels dilate, then the circulation of your blood can't move through your body as quickly, which can lead to a blood pressure drop and heart rate changes, and then passing out, which is what has started happening to me.
Oh my gosh. So there's also the tricky question of what causes POTS. In Michaela's case, it was triggered by a viral infection. What else can cause this?
Yeah, so viral infections are certainly the most common. I think 40 to 50% of POTS cases have been tied to viral infections. But anything that leads to prolonged bed rest, so patients who have been hospitalized for a while, surgery, I think concussions has been implicated as well. So a number of different things, but usually there's some sort of trigger that then kind of starts this process.
Michaela's taking beta blockers now. What do beta blockers do?
So beta blockers slow down the heart, and so they block the beta receptors in the heart, and that's what's stimulated when that kind of sympathetic part of the autonomic nervous system is activated. It hits those beta receptors and causes that really fast heart rate. And so beta blockers will block that so that it slows down that heart rate. So maybe her heart rate doesn't go up to 210, but probably somewhere in the low 100s or something like that would be what we would hope to see.
It's hard to pick a worst, Michaela, I'm sure, when you think back to when your POTS was at its worst, but were there any moments that were the most severe that stick out to you, the most debilitating?
So as they mentioned a little bit in the intro, and there's a couple of photos, I had to use a wheelchair for about a month in the summer, the first summer after my initial COVID infection. So this is pretty immediately after my POTS diagnosis, when we were still kind of figuring out the treatment and what I needed to do. And the hot weather combination of that and not having the appropriate treatment set up just yet, I was having so many episodes of passing out or near passing out and heart rate changes and dizziness that I literally could not walk without, or like stand up and sit down. And so I was using the wheelchair to prevent me from passing out so I could get through the day.
I can't imagine what it was like having those symptoms and then you get this wonderful, joyful news that you're pregnant. Were you scared at all that this was going to continue throughout your pregnancy?
Right. Dr. Comfort mentioned how, some pregnant patients, and luckily I have ended up being one of them, have a decrease of symptoms because of the increased blood volume. But at the time, the doctor, my cardiologist and my primary care doctor said it could go any number of ways. Things could get better. Things could get a little bit worse. We just don't know. We're just going to have to monitor closely. And so my first trimester, I was a high-risk pregnancy. And thankfully, because things improved so much in that first 12 weeks, that I ended up just being kind of downgraded to a regular OB for the rest of the pregnancy after that. So I was very scared at first, just not knowing what my body might do in reaction to the pregnancy.
And recently, do I understand correctly, you dipped your toe in the waters of trying to wean off the beta blockers. How did that go?
The cardiologist that I work with at KU, Dr. Ramirez, who's phenomenal, he and I talked about, now that things have been going well, even postpartum, what are the odds that if I stop taking my medication, my symptoms would not come back? And he said there's really only one way to find out. And so we did a trial, essentially, where we just stopped and waited to kind of see what happened. Unfortunately, it only took about 2 days, maybe not even 2 days, before I started to notice the symptoms. And our original plan was to try not taking them for a week and see what happened. And I stopped after 4 days of not taking the beta blockers. I just decided to go back on because my symptoms started to come back pretty much immediately. And so that said, going back on, they went back again, which is even, prior to pregnancy, I was taking the beta blockers, but I was still having a lot of symptoms in addition. And so during and now post-pregnancy, just the beta blockers themselves have reduced my symptoms about 90% or so. So it didn't go great to trial going off of them. But for now, that's all right. I'll just keep taking the meds and let them do their job. So
that must be such a comfort, though, to know that there's something you can take that helps, because when you're first diagnosed with this, I know from speaking with you, you felt so hopeless and such despair until you came here that nothing, your mind starts to spiral. You worry, what if this never gets better? And now you've got plans in place and medications that have improved your symptoms 90%. You're still living with this disability that's often called the invisible disability. Is it frustrating to go through life and sometimes come across someone that doesn't understand what's wrong or doesn't see it?
Definitely is. And, the whole category of invisible disabilities, it was invisible to me too until it happened to me. So it was a very eye-opening experience, particularly at its worst when I was using the wheelchair, the mobility aids, because when you look at me, even then, you can't see, there's no physical disability or indication that something is wrong. I mean, obviously, if you see me pass out, but ideally, we would not want to get to that point. And so having to use a wheelchair in order to avoid that was a challenge. And everybody would look at me as this young, 29-year-old person at the time and say, why are you using a wheelchair? Or, I saw you 6 months ago, what's going on now? And kind of having to explain not only what was happening to me, but also kind of helping to explain to people that not all disabilities are visible. And it's important not to, judge and jump to reactions when you see people who appear to be healthy using a mobility aid or something else that you don't think they need. So kind of working with that or against that stigma has been a growing experience for me, for sure.
Can you share some of the ways that you've chosen to modify your day-to-day life?
We talked about the hot showers a little bit. Thankfully, I'm at a place now. There was a time where I just couldn't take any hot showers or baths or anything like that. But thankfully now, with the combination of the medication and learning to manage my symptoms, I'm able to do that. But I have to, if I'm taking a bath or in a hot tub, I know I have to get out of those when I'm changing my position. I know I have to do that in a specific way to try to avoid any of that dizziness and fainting that comes with that. And then I know that if I want to do something like go for a long walk or go hiking, which is something I enjoy, I have to make sure that I'm choosing a trail that has places where I can sit, even if it's just like a rock or a formation or something that I can take breaks. And I know that sounds a little counterintuitive because technically I am changing my position, but when you're dealing with elevation and whatever else while hiking,
Sure.
those things are also impacting your heart rate. So I have to manage my pace, first of all, not go as quickly as I would like sometimes, and then make sure I'm taking breaks to allow my heart rate and blood pressure to kind of equalize a little bit before I keep going. I've been able to get back into yoga. That was something that initially POTS took from me because of all the positional changes. I couldn't do it without passing out. And then during pregnancy, I started to be able to do it again. And post-pregnancy, I've been able to do it again as well. So there's still a little bit of, certain things, certain poses that I need to modify or reduce the amount of time I spend in those poses, but I'm able to get back into those. And then if I'm going somewhere like a fair or some sort of public event, I have a portable little chair that folds down and I can just carry it by a handle that I keep in my car that I can always take with me, so that like prolonged periods of standing, which tends to be dangerous because the blood can pool in your feet. And then when there's blood pooling in your feet, it's not in your brain, which leads to more passing out. So I have made some adaptations to those things, and there's just things that I think about now, and it's routine now, but things that I never thought about before.
And how old is your son now?
17 months old now.
17 months old, and his name is August, right?
Yes, and he's doing phenomenal.
And you're actually, we want to share with our viewers, you're such a good mama. You're doing this podcast because this newscast, because you want to share your journey and educate the public. You're also, you're juggling a lot of things right now because you're at a doctor's appointment for your son. So Michaela has snuck away to a little room. So the connection is kind of going in and out because you're in a doctor's office, but we really appreciate you making time for us. And Dr. Comfort's nodding his head. Yes, she's a good mama, busy mama. What are you looking forward to most, Michaela, in the future?
I'm looking forward to getting my life back. I know that there might be some things that are different, like the modifications that I've talked about. Those may be things that I end up having to do forever, or they may improve. There's no way to know. Time will tell. But I'm looking forward to, now that I have the tools and the modifications, and I have, a more general positive outlook, and I feel like I can actually start to explore some of those things and get back to doing the things that make me feel good and make me feel most like myself. I feel a lot less inhibited by this diagnosis now that I have it much more managed thanks to the great team at KU Med. So I'm looking forward to being able to do those things, and obviously watching our son grow up and being able to share those things with him and stay active with him. As he's now walking and getting to the age of crawling and climbing around, there's going to be a lot of positional changes for me as I grab him off of things he shouldn't be on and such. So we'll see how that part goes, but I'm looking forward to it. I'm not fearing it. So that's a good feeling.
I want to bring Dr. Comfort back in as well, because Dr. Comfort, Michaela, has talked so much about how she's been given hope by coming here. And she mentioned her cardiologist, Dr. Rigo Ramirez, who's phenomenal. She's in great hands. With the beta blockers, is it all right if she just stays on those and tables the weaning off, trying to wean off? Is there any risk to staying on those? No,
it's a really safe medication.
Right.
And so, fortunately, that's a med that even if you're on it lifelong, that's really not going to be problematic.
So it's is it more of a mental thing, Michaela, where you just mentally wanted to see if you could do it?
And, because things had improved so much with pregnancy and postpartum, I was just feeling optimistic, like, hey,
sure,
let's give it a whirl here. But it's all right. Like Dr. Comfort said, they're a safe medication. And right now they're helping my body to do what it needs to do. So we'll stick with it as long as we need to.
Just take that worry and put that worry away, because you don't need to worry about that. And Dr. Comfort, when we talk about POTS is it's one condition under the bigger umbrella of long COVID, and we've talked about the ongoing research into long COVID. What's your take on the current understanding of long COVID? This is such a frustrating diagnosis.
It so is. And, I think, we think back to 2020 and 2021, and when we really didn't know anything about long COVID at that time, and where we are today. We've certainly made progress. And I know anybody who's suffering from long COVID, or anybody who's treating patients with long COVID, it's slower than we would like. But I do think we have a pretty good understanding of, what is long COVID, what are the symptoms that people are typically going to have, how long might they last. I think we've got a good understanding of risk factors and things like that. And so where we really want to get to is the treatment side of that. And so that's really where there's a lot of active research going on. I think you've had Dr. Castro on here before. He's in charge of our RECOVER trial. And the RECOVER trial first was like describing COVID, and now they've really moved into doing treatment trials for brain fog and fatigue and sleep, and even some autonomic dysfunction like what Michaela is dealing with. And so that's really where we want to go, is to get that treatment side of that. Unfortunately, we still don't have a universal treatment or an easy fix, and part of it is that not everybody with long COVID looks the same or has the same symptoms, and it goes to the complexity of probably what's driving that, which is probably lots of different mechanisms, and not every patient has the same mechanism going on and that sort of thing. So it's complicated, but there certainly has been a lot of progress being made.
And such different symptoms based on the person.
For sure,
who
100%.
is suffering with long COVID. We know you have plenty of questions. We love when our viewers send in questions and communicate with us. And you can do that on YouTube, Facebook. You can reach us on the X platform, or you can email the Medical News Network. We have all the ways to connect with us in real time right there on your screen. And we have Dr. Dana Hawkinson as well in studio with us for an update on our COVID count. Dr. Hawkinson's the Medical Director of Infection Prevention and Control. Dr. Hawk, this is such an interesting conversation. You see the patients in the acute form of their infections, and what's it like as a doctor to see these people continuing on their journey with long COVID?
Yeah, I mean, it's always good to treat the patients, and of course it's always good when they recover from their acute illness, but we know that a good majority or a good group, a good percentage of them do continue to have symptoms afterward. Now, there are different symptoms, and that is significant. It is significant in the part it plays in their life, their ability to work, do regular life things, parent, just be out there. And so we do understand how it affects people. It is significant, but I think to both of your points, it is a really subjective diagnosis. So the first part was diagnosing it or defining it, and that was very difficult in the early days because so many people have different symptoms. They have different manifestations. And going to that, a lot of them are symptoms. We don't see a lot of signs necessarily. So symptoms are what you feel as a patient and what you describe to your physician. And signs are more objective and things that we can see. Obviously for POTS, we can see that with the blood pressure and the heart rate. But other things like shortness of breath or brain fog, we don't always see imaging studies that show differences. We don't always see changes that way. But just as you talked about, so there is a lot of research going on to, number one, help define this, and then also help find the mechanisms of what is causing that as well.
When we talk about new studies, every new study on long COVID is an individual puzzle piece, right?
Yeah.
And last month, we got another piece of the puzzle related to brain fog, which is, if you've had brain fog, it's so frustrating. A study out of Ireland was published in Nature Neuroscience, and it linked long COVID brain fog to something called a leaky blood-brain barrier. What is a leaky blood-brain barrier?
So the blood-brain barrier is basically the blood flow to your brain, and that is done by vessels, larger vessels, but also smaller vessels getting into the deepest corners of the brain as well. So there is a blood-brain barrier because not everything is flowing in and to and through the brain tissues. We really want that to get oxygen and nutrients. So what that is, the leaky blood-brain barrier, what this study showed was that they actually looked at imaging. And before I said it's hard because there aren't a lot of objective findings. They looked at images from people with long COVID and people who didn't have long COVID, such as MRI of the brain, and found that there was some leaky blood vessels, if you will, showing some of the blood or the blood products going out into the brain tissues. But they also looked at other things such as chemicals that maybe our immune system secrete. And we have known for a while that some of those chemicals or those interleukins, other proteins that our immune system secrete, we know that that is dysregulated or can be seen as being dysregulated in people with long COVID. They found that in these studies as well, and also dealing with the brain, the organ itself. So again, I think we are getting to find some of the objective findings to help correlate with these subjective symptoms that these patients are feeling. Again, it is very complex, but I think this is, just as you said, one piece of the puzzle to figure out how and why some of these symptoms occur. And then just as Dr. Comfort said, there's not one treatment, but maybe trying to find a treatment for this particular affliction, the brain fog itself.
We have plenty of viewers who are asking questions right now, so I want to go to the community questions and the comments because we have a bunch of them. Ruth Ellen wants to know, Michaela, can you drive a car? Did you?
Sitting down. Can you hear me okay?
Now I can hear you. There's a little bit of a delay, so it's cutting off the first couple of words of your answer. So can you drive a car?
Yes, I can. When I'm in a car, I'm sitting still. I'm not changing positions. And so as long as I'm in the same position, everything has been totally fine. So I am safe to drive.
That's very liberating, especially as a parent. You got to be able to, you're dragging yourself all around town for appointments. Joellen has a question. Joellen McGranahan wants to know, Dr. Comfort, could you please discuss more the issue of fatigue and blood pressure medication? I'm not sure if there's a connection between fatigue and blood pressure medication, but
so if we're talking about fatigue with long COVID, maybe that's...
Yeah, I think that's...
Yeah, that is certainly the number one symptom that our patients with long COVID report to us. And the fatigue that people describe to us, it is very profound. It's like can't get out of bed, can't get to work, can't take care of your kids and that sort of thing. And so, and that's a complex mechanism. I think to Dr. Hawkinson's point, some of this actually has been tied to research kind of looking at neuroinflammation, inflammation around the brainstem, and things like that may be kind of controlling some of those factors. And so that's a big deal with our patients with long COVID. And I'm not sure about the blood pressure question. Exactly,
she wanted to know about the medication that can be taken for that blood pressure, that change in blood pressure.
Oh, well, so it depends on the situation exactly. So, Michaela's taking one that actually, could potentially lower blood pressure, but it's really intended to slow down that heart rate. So, her main symptom is really fast heart rate, so that's intended to slow that down. Occasionally patients will have such severe symptoms when they stand up and really lightheaded that we actually use medications to raise their blood pressure.
Oh, interesting.
And so those are specific medications that can constrict blood vessels or promote kind of salt reabsorption so that you can kind of increase your plasma volume and things like that.
Georgianne has a comment for Michaela. Georgianne writes, "Thank you, Michaela, for sharing your experience and best wishes to you." And then Jeremy Yenser, one of our viewers, wrote something really nice. Jeremy says, "Not a question, but just some praise for Michaela. That sounds like a lot of adjustments and a lot of disruption at a really challenging time with a small child. And I'm sure there are down days, but you're killing it. Very admirable, and so much strength and determination."
Expecting this little boost this morning. Thank you so much, Georgianne and Jeremy both. Thank you.
We're filling your bucket. That's what my son would have said in daycare.
Sure.
Filled my bucket.
Love it.
Yen Liang has a question. He wants to know, could exercise lower the impact of long COVID?
Ooh, tough question there. So let's talk about POTS, because I'm going to separate it a little bit. So, POTS is part of the long COVID kind of tree here. And so, in patients with POTS, we know that exercise really does help. It's got to be done in the right way, usually not in a standing position. So using a recumbent bike, a rowing machine, sometimes swimming, things like that. Because we know in POTS in particular that you can, really one of the common final pathways is you get cardiac deconditioning. So even in as little as 20 hours of bed rest, you can start to see kind of thinning of the cardiac muscle tissue. And so naturally patients with POTS are going to be less active and things like that. So we get cardiac deconditioning. So it becomes really important. What we've found, though, in our long COVID patients who are struggling with fatigue or post-exertional fatigue, exercise can actually be counterproductive. And so in that case, we really recommend having that done in a structured environment, usually under the care of one of our physical therapists. There are some athletic trainers that are familiar with long COVID because it's a really different approach, and it's a much more graded, it's kind of a start low, go slow sort of mentality. And so really kind of picking it up very slowly over time, because if you go too quickly, we actually end up getting a big setback. So it's a tricky question. So we want exercise, but that really needs to be done under supervision of a physical therapist.
Well, that was from working with you when I had long COVID, not to Michaela's extent, but I had called you and you said, exercise is not your friend right now. Don't push through. Like you push through a cold or you're feeling rotten and you're just like, I'm just going to keep going for a walk. It'll make me feel better. You said this is the one illness where pushing through is not the way to go.
Yeah, exactly. And we learned that the hard way, right?
Yeah.
We were telling our patients, just like we've had for years, push through this, you got to get out there, you got to keep moving. And we found that we were actually not helping them. We were slowing down their progress. And so, that's one of the areas of research I think is really kind of, by sharing all of that, we've kind of figured out that we need to do this a little differently than we typically did.
We have one more viewer question. Susan Boughton Escareno writes, are heart palpitations a symptom of long COVID?
It definitely can be. So that's one of the common ones that gets reported, and sometimes that's accompanied with fast heart rate, but sometimes not. Sometimes we just feel some erratic heartbeats or extra heartbeats and things like that. So it definitely can be a sign. If you have that, or a symptom, and if you have that symptom, I'd recommend reaching out to your primary care doctor and getting evaluated.
I want to bring Michaela back in for today's takeaways. Michaela, this is such an interesting conversation. Again, thank you for fitting us into your schedule today. You're so busy. You're like a superwoman. What do you want people watching to know?
The biggest thing I want people watching to know is that, COVID has these wide-ranging impacts on people. And so it's important to listen to your own body and talk with your own doctor about the symptoms that you're experiencing, both during your acute infection and then afterwards as you're healing. Like you said, you reached out to Dr. Comfort when you were sick. I think that's awesome, because what might be good for you individually is different than what might be good for your friend or your neighbor. So it's important to talk with your own healthcare team and help them develop an individualized treatment plan if you're experiencing any of these long-term effects in particular.
Dr. Comfort, what do you want our viewers to know?
So what I always tell my patients with long COVID is really to maintain that hope and optimism. And I know that's much easier said than done. If you're 6-7 months into your course and you're thinking this is never going to end, what we've seen is most people do get better over time. And so time right now seems to be our best treatment tool. The body or nature heals, right? And so we do tend to see most people get better over time. And so just maintain that hope and optimism as you're going through this journey.
But Michaela is such a hopeful, she's like a beacon of hope because we've seen her through this journey and she's coming out the other side and doing so well. Dr. Hawkinson, what would be your final takeaway for our viewers today?
Yeah, I think it would be echoing Dr. Comfort. What we have seen is that as time moves on, people do get resolution of their symptoms or greatly improved symptoms. So I think there is that room there to be optimistic. We also know there is good data to support that vaccines can help reduce getting long COVID, because we know even if you have mild COVID, you can get symptoms of long COVID. And even we've heard some people anecdotally also say their symptoms improved when they did get the vaccine as well. So there are things out there to help reduce your chance, but remain optimistic, because as time goes on, we have seen that people do recover from this or have their symptoms greatly reduced. And we will continue to look at the research, especially from the RECOVER trial, looking at what causes long COVID, but also what are the best ways that we can go treat that to make sure that the people that are suffering from long COVID can have a reprieve from those symptoms.
And before we go this morning, we want to wish a good luck and hats off to the Kansas City Royals as they begin their new MLB season. And the health system has been the club's official healthcare provider since 2011. We caught up with Royals general manager JJ Piccolo, who said the health system partnership actually helps a little bit when it comes to recruiting players.
This year was a big year for us with free agents. They ask questions, our wives ask questions about what's the medical support like, and having KU behind us is a tremendous asset. So it's been a great partnership. It extends far deeper than just the players you see here in Kansas City. It extends to employees, extends to our minor league players. So it's really a healthy thing that we're very thankful and grateful that we have this partnership.
Last night's home opener ended in a 4-1 loss to the Twins. Best of luck to the Royals for the rest of the series this weekend and the rest of the season. It's a long season. We got plenty of time. Thanks again to our guests, and thank you to our viewers for being with us today, and a thank you to Michaela for sharing her journey. Have a great weekend. We'll see you back here on Monday morning.
Coming up Monday on the Morning Medical Update, Emma Stiles knows what it takes to compete, but when this collegiate diver switched sports, her body needed to switch too. I'm Jessica Lovell on the next Morning Medical Update, how this athlete found the knowledge and support she needed to stay on the competitive stage.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.